Hi, and welcome everyone. My name is Annette Rezga. I'm one of the nurses here at Community Hospice. And today we're going to be talking about caregiving for high-risk people during COVID-19. The presentation is brought to you by Community Hospice and Sutter Health. Okay, so we can go ahead and get started. So, what you need to know. It's important to know that anyone can have mild or severe symptoms of COVID-19. Older adults and people with severe underlying medical conditions are at higher risk to develop more serious complications. So those with heart disease or lung diseases, diabetes, etc., are at higher risk for COVID-19. People with COVID-19 have a wide range of symptoms that have been reported, and they have been ranging from mild to severe. What you need to know. We need to know how COVID-19 spreads. Currently, right now, there is no vaccine to prevent COVID-19. The best way to prevent the illness is to avoid being exposed to this virus. The virus is thought to be spread mainly from person to person through close contact. That means within 6 feet. The virus is known to spread through respiratory droplets that are produced when an infected person coughs, sneezes, or talks. They can be inhaled by the person and enter into the lungs. Some recent studies have suggested that COVID-19 may be spread from people who are not showing symptoms. Symptoms of COVID-19. Mostly symptoms appear 2 to 14 days after exposure. Some of the symptoms are fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. This list does not include all of the possible symptoms. The CDC will be updating the list as more symptoms come available. When to seek emergency medical attention. Look for emergency warning signs for COVID-19. If someone is showing any of the signs, please seek emergency medical care immediately. If they have trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, please call 911. The list above does not include all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Ways to prevent getting and or spreading COVID-19. Wash your hands. Everyone should wash their hands often. Wash your hands with soap and water for at least 20 seconds, especially after you have been out in public, blowing your nose, coughing, or sneezing. If you do not have soap and water readily available, use hand sanitizers that contains at least 60% alcohol. Cover all the surfaces of your hands, rub them together until they feel dry, and avoid touching your eyes, nose, and mouth with unwashed hands. Maintain 6 feet distance. Stay at least 6 feet, about 2 arms length from other people. Stay away from anyone who is sick, including household members. Put 6 feet distance between yourself and any other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Keep a distance from others, especially important for people who are at higher risk of getting very sick. Cover your mouth and nose. Cover your mouth and nose with a cloth covering when around others. Everyone should be wearing a cloth cover when they go out in public, when you go to the grocery stores or to pick up any necessity or for any other reason that you go out in public. Face coverings should not be placed on young children under the age of 2, anyone who has trouble breathing or is unconscious or is otherwise unable to remove the mask without assistance. The face cover is meant to protect other people in case you are infected. Do not use a face mask meant for healthcare workers. Continue to keep your 6 feet distance between yourself and others. Wearing a cloth cover is not a substitute for social distancing. Please note, during COVID-19 pandemic, medical grade face masks are reserved for healthcare workers and some first responders. You may need to make a face cloth covering using a scarf or a bandana. Cover coughs and sneezes. If you are around others and you do not have a face cover, please remember to always cover your mouth and nose with tissue when you cough or sneeze. Or you can use the inside of your elbow, and please do not spit. Throw away any used tissues in the trash. Immediately wash your hands with soap and water for 20 seconds. If you do not have soap and water, readily available, please use hand sanitizer that contains at least 60% alcohol. Clean and disinfect, something in the air. Clean and disinfect frequently touched surfaces daily. That includes tables, doorknobs, light switches, countertops, handles, your desk, phone, keyboards, toilets, faucets, just any area that you may touch. If that surface is dirty, clean them. Use a detergent or soap and water prior to disinfection, and then use a household disinfectant. Caring for someone that is sick with COVID-19. Learn what to do when someone has COVID-19 or when someone has been diagnosed with the virus. This information should be followed when caring for people who are tested positive but are not showing symptoms as well. Caring for someone sick at home or other non-healthcare settings, Provide support and help cover basic needs. Help the person who is sick follow their doctor's instructions for care and medicine. For most people, symptoms last a few days and they usually start to feel better after a week. See if over-the-counter medications for fever can help the person feel better, such as acetaminophen. Make sure the person who is sick drinks a lot of fluids and gets lots of rest. Help them with their grocery shopping, filling prescriptions, and getting other items they may need. Consider having the items delivered through a delivery service if possible. A lot of the stores nowadays do have delivery services that will bring them to your door and is non-contact. Take care of their pets and limit the contact between the sick person and their pets. Thank you. Caring for someone who is sick. The caregiver, when possible, should not be someone who is at high risk for severe illness themselves. Use a separate bathroom and bedroom when possible. If possible, have the sick person stay in their own room. Keep them away from others. Try to stay at least 6 feet away from the sick person. If you do have to share space, make sure the room has good airflow. That means you open the windows, open doors, use a fan to increase the air circulation, and avoid having visitors. Eat in separate rooms or areas if possible. Have them stay in their room to eat or be fed if possible. Wash dishes and utensils using gloves and hot water. Handle any dishes, cups, glasses, or silverware used by the sick person with gloves. And immediately wash your hands after taking the gloves and handling those items. Avoid sharing personal items with the sick person. So do not share your dishes, your cups and silverware, etc. Wear a cloth cover and gloves at all times when caregiving. Protect yourself. Protect yourself when caring for someone who is sick. Limit your physical contact. COVID-19 spreads between people who are in close contact within 6 feet through respiratory droplets, which are created when people talk, cough, or sneeze. Wear a face covering. I know we like to keep in contact with our loved ones, and this young lady shows that she's enjoying someone visiting through her phone, so it could be like FaceTime or Zoom, just like we're doing now. The caregiver. Wear gloves when you touch or have contact with a sick person's blood, stool, body fluids, saliva, mucus, vomit, or urine. Throw out the gloves in a lined trash can and wash your hands right away. The caregiver should ask the sick person to put on a face covering before entering the room. The caregiver should always wear a face covering when caring for the person who is sick. Please note, during COVID-19 pandemic, medical grade face masks are reserved for healthcare workers and some first responders. You may need to make a face cloth covering using a scarf or bandana. Bedroom and bathroom. Clean the area around the sick person as needed, such as when the area is soiled. This will help limit your contact with the sick person. If they feel up to it, you may provide them with cleaning supplies so they can clean up their own space. If sharing a bathroom, the sick person should clean and disinfect after each use if they are able. Wear a cloth face covering and wait as long as possible after the sick person has used the bathroom before coming in to clean and use the bathroom. Wash and dry laundry. Do not shake dirty laundry. Wear disposable gloves while you're handling the dirty laundry. Soiled laundry should always be held away from the body or transported in a laundry basket. Dirty laundry from a person who is sick can be washed with other people's items. Wash them according to their labeled instructions. Use the warmest water setting you can. Remove the gloves and wash your hands right away. Dry the laundry on hot if possible and completely. Wash hands after putting clothes in the dryer. Line trash cans. Use line trash cans. Use gloves when removing garbage bags and handling and disposing of trash, and wash your hands afterwards. Place all used disposable gloves, face masks, and other contaminated items in a lined trash can. If possible, dedicate a lined trash can for the person who is sick. Caregivers should stay home. Caregivers should stay home and monitor their health for COVID-19 symptoms while caring for the person who is sick. They should also continue to stay home after care is complete. Caregivers can leave their home 14 days after their last close contact with the person who is sick, based on the time it takes to develop the illness, or 14 days after the person who is sick meets the criteria to end home isolation. If you are sick, wear a face cloth covering when you are around other people at home and out, including before you enter the doctor's office. Cloth face coverings help prevent a person who is sick from spreading the virus to others. Your covering should not be placed on young children under the age of 2, or anyone who has trouble breathing or is not able to remove the covering without assistance. Watch for warning signs. Have the doctor's phone number on hand. Use the CDC's self-checker tool to help you make decisions about seeking appropriate medical care. Call the doctor if you keep getting sicker. For medical emergencies, call 911 and tell the dispatcher that the person has or might have COVID-19. Monitor your health. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19, especially if you are running essential errands, going into the office or workplace, and in a setting where it may be difficult to keep a physical distance of 6 feet. Wear a facial covering. Use the CDC's self-checker tool to help you make decisions about making appropriate medical care. If you have trouble breathing, call 911. Call your doctor or emergency room and tell them your symptoms before going in. This will enable them to tell you what to do. Take your temperature. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medication that could lower your temperature, such as acetaminophen. Steps to help prevent the spread of COVID-19 if you are sick. If you are sick with COVID-19 or think you might have COVID-19, Help protect other people in your home and community. Please stay home. Most people with COVID-19 have mild illness and can recover at home without medical care. Do not leave your home except to get medical care. Do not visit public areas. Take care of yourself. Get rest and stay hydrated. Take over-the-counter medication such as acetaminophen to help you feel better. Stay in touch with your doctor. Call before you get medical care. Be sure to get care if you have trouble breathing or have any other emergency warning signs, or if you think it is an emergency. Avoid public transportation, ride sharing, or taxis. Separate yourself from other people. As much as possible, stay in a specific room and away from other people and pets in your home, and use a separate bathroom. If you need to be around other people or animals in or outside of your home, please wear a cloth face covering. Remember to wash your hands. Everyone should wash your hands often. Please use soap and water for at least 20 seconds, especially after you've been in a public place, or you are blowing your nose, coughing, or sneezing. If you do not have soap and water readily available, please use hand sanitizer that contains at least 60% alcohol. Cover all the surfaces of your hands with the sanitizer and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, and any other areas that are touched. If surfaces are dirty, clean them. Use detergent or soap and wash the area prior to disinfection. Then use a household disinfectant to disinfect the area. To clean electronics, follow the manufacturer's instructions. If those directions are not available, use an alcohol-based wipe or a spray containing at least 70% alcohol. Call before visiting your doctor. Call ahead. Excuse me. Excuse me. Call ahead. Many medical visits for routine care are being postponed, are done by phone or telemedicine. So if you have, a medical appointment that cannot be postponed, please call your doctor's office and tell them that you have or may have COVID-19. This will help the office protect themselves and other patients. If you are sick, wear a cloth covering over your nose and mouth. Try to stay at least 6 feet away from other people. When is it safe to be around others after COVID-19? Deciding when it's safe to be around others is different in different situations. The decision to discontinue home isolations for persons with confirmed or suspected COVID-19 should be made in context with local circumstances. Options include a symptom-based, such as time since illness onset and time since recovery strategy, or a test-based strategy. Please contact your physician to learn when it is safe for you to be around others, since each situation is different. A takeaway: layering protective and healthy habits can help limit the spread of germs with COVID-19. This not only limits the spread of COVID-19, but it also helps protect all high-risk people from any other viruses. Good hand hygiene, staying home if you're sick, wearing a mask, social distancing, covering your coughs and sneezes, avoid touching your face. All of these areas should always be taken into consideration at all times. For the most up-to-date COVID-19 guidelines and information, you can visit the CDC's coronavirus website. Additional resources can be the California Department of Public Health, Stanislaus County Health Services Agency, San Joaquin County Health Services Agency, and the World Health Organization.